Welcome to Unit 13 around managing or providing support to manage pain and discomfort. So, this unit really looks at supporting people with their emotional and physical well-being. And we're aware that people can be in pain and discomfort for many reasons. So, it's important that we look at people as we're providing personal care. Now, we know that people are able to communicate and say to us that they're in pain and discomfort. Some people aren't able to communicate, non-verbal, meaning we have to look at the cues. Do they flinch? Do they shrug their shoulders? Do they look scared? And if they do, we can assume that they're in pain and discomfort. It's helpful to understand somebody's level of pain. We can do a pain scale. We can ask them, on a scale of 1 to 10, how much pain are you in? 1, I'm not in much pain, to 10, I'm in a lot of pain. It's important to understand that some people are afraid of pain, and therefore we need to be mindful of that. We know that ourselves, if we're sitting for a long period of time, we can end up in pain and discomfort. So it's important that we recognise that other people can too. We also know that some people may be prescribed pain medication, and therefore before we carry out any care task, it's important to see whether that pain medication has been given. Equally, if we're going to carry out any treatments, so we're going to start pulling people's joints or changing wounds or dressings, it's important to know that somebody's had some level of pain relief before. So let's look at learning outcomes. So 1, we need to understand the approaches for managing pain and discomfort. 1.1, the assessment criteria, wants you to explain the importance of holistic approaches in managing pain. So the holistic approach is simple. We should be checking people from head to toe. We need to be checking their physical and psychological well-being. And that takes skill. It takes time for us to really step back and look at what we're doing. So if we're going to do a moving and handling task, have we got the slings in the right place? Have we got the hooks in the right place? And when we position somebody down, are we sitting them in a position where they're not sitting on their anatomy and their material's not crumpled up and it's not discomfort? And again, when they sit back and they rest their head, are they comfortable? We know the importance of being in pain-free. If somebody's in pain, it can affect their mood, it can affect their appetite, and it ultimately affects their ability to recover. So it's important that when we work with people, we're using our signs and symptoms and our observations. We're observing the small detail, we're checking everything, and we're asking the right questions. So the different approaches in alleviating pain and discomfort will differ from people to people. However, there is the biomedical approach, so giving people medication, and the psychosocial, so trying to find other ways around providing care. So the medical approach could be that we offer pain relief. So that could be things such as paracetamol or ibuprofen to help reduce inflammation, pain, and swelling. But there are other approaches to alleviating pain. We could use hot and cold treatments. We could use physio. Maybe there's some exercise. Maybe we need adaptations and equipment. So it's important to realise that not one approach will work for everybody. And sometimes you may need a combination of approaches. You may need pain relief, you may need some hot and cold treatment, and you may need adaptations and adjustments. If you're not sure, it's useful to do some work with the pain clinic to find out best way forward. So it agrees ways of working to manage and reduce pain and discomfort really is by looking at the care plan, seeing what the nurse has already suggested. Maybe physio has worked and the occupational therapists have been part of that process. Maybe a doctor's prescribed pain relief, or maybe some gels. Or maybe there's just different ways of working, and we can work in a multidisciplinary way and personal-centered way by putting the person at the centre. Maybe just observing simple rules around pressure relief, making sure that people are walking and the skin integrity is good, making sure that they're eating a well-balanced diet to help cell repair. Number two wants us to be able to assist in minimizing pain and discomfort. So describe how pain and discomfort may affect the individual's holistic well-being and communication. We know that if we're in pain, it makes us fatigued, it tires us out, it can change our mood and mental state. We can become aggressive, we can become more argumentative, we're tired, and that pain just becomes dragging. The way in which we communicate isn't necessarily as clear. Equally, some pain medication may be making them not as clear as they normally are. So there's lots of things in the way that pain alters our mental health and well-being. 2.2 looks at encouraging individuals to express their pain. If they're able to communicate verbally, then we can just simply ask them. But if they can't communicate verbally, maybe we need pain scale charts. So pictures with the happy and sad faces, and they can point. It's important for us to find a way to measure somebody's pain. Again, we can even use our fingers and they can count. 2.3 is about how to recognize individuals' pain when they're not able to verbally communicate. So here we're going to be doing our observation skills. We're going to be looking at their face when we're talking, seeing if they're drained, looking if they're tired. Do they wince? Do they close their eyes? Do they shrug their shoulders? Do they cry? Do they just look uncomfortable? 2.5 wants you to explain how to evaluate pain levels using the assessment tools in your areas of work. Again, there are many alternative assessment tools. Google those. It's about finding the right ones for your customer. 2.6 is about encouraging individuals and the carers to use self-help methods for pain control. So again, having conversations around pain management and a pain plan is really useful. Encouraging movement is a great way to manage pain. The longer we sit still, the stiffer we become, the harder it is for us to walk. We need to try other alternative medicines, maybe such as herbal remedies, hot and cold treatment, or maybe physio or massage tools. When we sit people down, we need to make sure that they're positioned or laid down. We need to make sure they're positioned safely and they're comfortable. So again, we need to watch and observe what we're doing. We need to stand back and look in and decide whether or not somebody looks. Again, we can position the person and we know how we feel when we're positioned well or not well. 3.1 requires us to carry out monitoring in relation to managing the individual's pain discomfort. So some people will have medication called PRN, meaning they can take pain relief as and when required. If they're taking pain relief all the time, one assumes then it's no longer a PRN and it should become part of the normal medication process. If somebody is on long-term pain relief, then we need to look at what the effects are on the body. Maybe we need to do a medication review and review the medication. If the pain medication isn't working, then again, maybe that needs to be reviewed as well. You should understand the different types of medication and pain reliefs. So from simple over-the-counter stuff such as ibuprofen and paracetamol, to opioids such as cocodamol or codeines, moving into the morphines, working towards higher ends of pain scales. (2.8) requires us to carry out agreed measures to alleviate pain and discomfort. So again, it's important that you are aware of how that person works. So it may be the fact that you see them eating and you see that they're struggling. Maybe it's their teeth, maybe they're rubbing, and maybe they're in pain or discomfort. It's worthwhile you having that conversation with them. 3.1 about current required monitoring activities for individual pain and discomfort we covered. 3.2 complete records in line with agreed ways of working. So agreed ways of working will be you'll complete your online records or your paper-based records. But it's really important that if you're given pain relief medication, we're checking the dates and the time it's given because we don't want to overdose people. or make them or allow them to become addicted or rely upon pain relief. So it's important when somebody asks for the medication that we challenge them and find out why they need it. And if somebody says that they're in pain, we need to find out how much pain they're in. If you have any concerns, obviously you need to report those as well and report them to your line manager or to a nurse in charge. You can do this by filling in the care records, the daily notes, or any online activity. So let's just have a look where we're going. Learning outcome 1, we understood approaches in managing pain and discomfort. We talked about the holistic relieving pain without damaging the body. We could use alternative methods. We can promote the body's healing by promoting regular sleep, good eating and drinking patterns. It's about recognizing the whole person, so their physical and mental health. Approaches to managing pain, again, can look at using tablets, medication, therapy, CBT, or complementary therapy. Number 2, looks at ways in assisting and managing pain and discomfort. So that's about our skills in the way in which we move and handle people. We deal with their verbal and non-verbal cues. We ensure that we're managing their moods, their pains, and their discomforts, ensuring that people have the opportunity to express the way that they feel. And then in learning outcome 3, we talked about monitoring and recording. So making sure that we're using some level of pain scale for recording. We observe and record. So when we do ask people if they're in pain, we can back that up with our judgment. For example, if somebody says to you, "Oh, I need my pain medication, I'm in so much pain," does the behavior of the body replicate the verbal cues? Or do they go, "Look, I really need my pain relief," and you can see the fact that they are in pain? We should judge or make a decision based on that judgment. And finally, we need to report our findings, again, using the correct reporting methods and understanding that we're aware of regulations. So RIDDOR, Reporting Injuries, Dangerous Disease Occurrence Regulations, and the CARE Act 2014, and to understand our policies. Finally, there's additional reading materials here that you can go on to download or websites in which you can view. Thanks for watching. I hope you found this useful. To complete your assessment, you will need to download your workbook and you will be observed managing pain and discomfort within the place. Thanks.